medical emergency that occurs when your body loses heat faster than it can produce heat, causing a dangerously low body temperature. Normal body temperature is around 98.6 Fahrenheit 37 degrees Celsius. Hypothermia occurs as your body temperature falls below 95 Fahrenheit 35 degrees Celsius. When body temperature drops, heart, nervous system and other organs can't work normally. Left untreated, hypothermia can lead to complete failure of heart, respiratory system and eventually to death. Hypothermia is often caused by exposure to cold weather or immersion in cold water. Primary treatment for hypothermia are methods to warm the body back to a normal temperature. Signs and symptoms of hypothermia include shivering, sluttered speech or mumbling, slow shallow breathing, weak pulse, clumsiness or lack of coordination, drowsiness or very low energy, confusion or memory loss, loss of consciousness, bright red, cold skin in infants. Someone with hypothermia usually isn't aware of his or her condition because the symptoms often begin gradually. Causes: wearing clothes that aren't warm enough for weather conditions, staying out in cold too long, being unable to get out of wet clothes or move to warm, dry location, falling into water as in boating accident, living in a house that's too cold, either poor heating or too much air conditioning. Risk factors: exhaustion. Your tolerance for cold diminishes when you are fatigued. Older age. The body's ability to regulate temperature and to sense cold may lessen with age, and some older adults may not be able to communicate when they are cold. Very young age. Children lose heat faster than adults do. Mental problem. People with mental illness, dementia, or other conditions that interfere with judgment may not dress appropriately for weather or understand the risk of cold weather. Alcohol and drug use. Alcohol may make your body feel warm inside, but it causes the blood vessels to expand, resulting in more rapid heat loss from the surface of your skin. The body's natural shivering response is diminished in people who have been drinking alcohol. Certain medical conditions. Some health disorder affect your body's ability to regulate body temperature. Example: hypothyroidism, poor nutrition or anorexia nervosa, diabetes, stroke, severe arthritis, Parkinson's disease, trauma and spinal cord injuries. Medication. Some drugs can change the body's ability to regulate its temperature. Examples include certain antidepressants, antipsychotic, narcotic pain medication, sedatives. Complications. People who develop hypothermia because of exposure to cold weather or cold water are also vulnerable to other cold-related injuries, including freezing of body tissue, frostbites, decay and death of tissue resulting from an interruption in blood vessels. Prevention. Staying warm in cold weather. Cover. Wear a hat or other protective covering to prevent body heat from escaping from your head, face and neck. Over-excretion. Avoid activities that would cause you to sweat a lot. The combination of wet clothing and cold weather can cause you to lose body heat more quickly. Layers. Wear loose-fitting layer. Lightweight clothing. Outer clothing made of water-repellent material is best for wind protection. Wool silk inner layer hold body heat better than cotton does. Dry. Stay as dry as possible. Get out of wet clothing as soon as possible. Be especially careful to keep your hand and feet dry. Keep children safe from cold. Dress infant and young children in one more layer than adult would wear in the same condition. Bring children indoor if they start shivering. That's the first sign that hypothermia is starting. Don't let babies sleep in a cold room. Alcohol. To avoid alcohol-related risk of hypothermia, don't drink alcohol if you are going to be outside in a cold room, if you are boating, before going to bed on cold nights. Cold water safety. Water doesn't have to be extremely cold to cause hypothermia. Any water that's colder than normal body temperature causes. Wear a life jacket if you plan to ride in a watercraft. Get out of water if possible. Get out of water as much as possible, such as climbing onto a capsized boat or grabbing onto a floating object. Don't attempt to swim unless you are close to safety. Position your body to minimize heat loss. Use a body position known as heat escape listening position. Help to reduce heat loss while you wait for assistance. Hold your knees to your chest to protect the trunk of your body. if you're wearing a life jacket that turns your face down in this position. Bring your legs tightly together, your arms to your side and your head back. Huddle with others. Don't remove your clothing while you're in water. Don't remove your clothing because it helps you to insulate you from the water.